Here is a rewritten version of the text with a more organized and clear structure. Young bird disease. Understanding the risks and consequences. As a responsible bird owner, it's essential to be aware of the potential health risks that can affect your young birds. In this article, I'll discuss the symptoms and consequences of young bird disease, a common condition that can lead to losses, death, and a lifetime of health issues. Symptoms of young bird disease. The symptoms of young bird disease include loss of appetite, water consumption, unpleasant lines in the mouth, yellow crusty formations around the beak, weight loss, sleepy eyes, greenish droppings, poor digestion, watery droppings. These symptoms can lead to a range of health problems, including death, and often result in a bird that is never the same again. Circovirus, the bird AIDS virus. One of the primary causes of young bird disease is circovirus, also known as the bird AIDS virus. This virus weakens the bird's immune system, making it vulnerable to secondary infections. In my opinion, circovirus not only weakens the immune system but also causes its own set of symptoms, making it difficult to treat or cure. How circovirus affects birds. Once infected, circovirus can cause birds to drink excessively, leading to waterlogged crops. But why do they drink so much water? It's possible that they're trying to cool down their body temperature or alleviate digestive system irritation. Alternatively, it could be due to dehydration caused by organ failure, such as kidney failure. Circovirus is not just a secondary infection, but it has its own distinct infection process that can be deadly to birds. Unfortunately, the chances of recovery are slim once a bird is infected with circovirus. In my next article, I'll discuss other common health issues affecting young birds, including PMV, Salmonella, and I understand that you have provided additional information about the herpes virus and its effects on young birds. Herpes virus is a viral infection that can affect pigeons, and it is believed that most adult pigeons carry the virus without exhibiting symptoms. It is recommended to expose young birds to the herpes virus when they are under minimal stress. Some pigeon owners keep old birds in the same loft as the youngsters, as these older birds have likely been exposed to the virus multiple times. By exposing the young birds to the virus early on, they can develop immunity to it. When young birds hatch, they initially receive immunity to viral diseases from their parents through the egg and crop milk. However, this immunity is temporary and wears off within 6 weeks to 6 months. After this period, the young birds can become susceptible to viral infections, including herpes. Exposing the young birds to herpes virus while they are in the company of older birds allows them to build immunity without significant stress. If the young birds are exposed to the virus again later in life when they are under stress, they are less likely to be affected by it. However, if the young birds were never exposed to herpes virus and encounter it later under stressful conditions, they may show visible signs of infection. The signs of herpes virus infection in pigeons include greasy wattles, thin cheesy lines inside the mouth, watery sleepy eyes, heads pulled in somewhat, light crust around the beak, and weight loss. Infected young birds may also experience respiratory problems and canker-like symptoms, although this canker-like substance could potentially be a fungus. Herpes primarily affects the respiratory system, causing respiratory symptoms and overall sickness and lethargy in pigeons. It should be noted that not all pigeons recover from herpes, and those that do may experience fertility problems or general weakness. It is unclear if a pigeon that recovers from herpes will fully regain its health and vitality. Pigeons infected with herpes, similar to adeno and circoviruses, may exhibit slightly slower and less responsive behavior compared to healthy birds in the flock. Observing the movements and behavior of pigeons in a loft can help identify any pigeons showing signs of illness, even if the symptoms are subtle. Treating secondary infections associated with herpes virus may not provide significant help to the affected pigeons. However, if treatment is initiated within the first couple of days after the onset of symptoms, there is a greater chance of survival. Treating for canker and respiratory issues may be worth attempting, but once the pigeon appears severely ill, the effectiveness of treatment becomes limited. What can we do about young bird sickness? Based on the information you've provided, here are some key takeaways and potential actions to address young bird sickness. Understanding the problem. Young bird sickness is a complex issue caused by various factors, including viruses like circovirus and herpes, bacteria like Salmonella, and environmental stressors. Antibiotics are ineffective against viral infections, making them a poor choice for treating young bird sickness. Deep litter systems and grates can offer different advantages depending on your specific situation. Potential solutions. Boosting the immune system. Deep litter system. This system can strengthen the immune system before virus problems arise. As explained in your article, an immune system is a terrible thing to waste. Vaccinations. Vaccinating for PMV and Salmonella at specific times can boost the immune system while the young pigeons still have some parental immunity. Minerals. Providing all essential minerals can prevent weakness and support overall health. Deworming. Regular deworming can eliminate stress caused by parasites. Minimizing stress. Avoid overcrowding. Ensure adequate space for the young birds. Hygiene and sanitation. Maintain a clean environment to prevent the spread of pathogens. Exposure to old birds. Introduce old birds to young birds in a controlled manner to help them build immunity to herpes virus. Minimize mixing of pigeons. Avoid mixing pigeons from different lofts to reduce stress and the risk of introducing new pathogens. Additional considerations. Consult a veterinarian. Seek professional advice for specific cases and treatment options. Observe and monitor. Closely monitor your pigeons for any signs of illness and act promptly. Hygiene and biosecurity. Maintain strict hygiene practices to prevent the spread of diseases. Further resources. Your article, An Immune System is a Terrible Thing to Waste. Information on pigeon diseases and treatments from reputable sources like veterinary websites or pigeon fancier organizations. Remember, prevention is key. Implementing proactive measures to strengthen the immune system and minimize stress can significantly reduce the risk of young bird sickness. Early intervention is crucial. If you suspect your pigeons are sick, seek veterinary advice and treatment promptly. By following these recommendations and staying informed, you can take proactive steps to protect your young birds and promote their health and well-being.